Neurological pain, also referred to as nerve pain, is often very intense and long-lasting, and approximately 2 to 3% of the population experiences neurological pain that is treated with pain management. We spoke with Dr. Medhat Mikhael at Hoag Memorial Hospital Presbyterian in Newport Beach and asked him, what is pain management?
Pain management is a specialty of medicine that deal with all aspects of pain, whether acute or chronic, and deal with pain as a disease, not a symptom, and believe in managing pain in a multidisciplinary approach.
What are the symptoms that require pain management treatments?
If you have acute pain that fail to respond to conservative measures, or chronic pain where patients started developing other complications from untreated chronic pain, that patient needs to have that pain addressed and treated by a pain specialist.
At what point would a patient's primary physician contact a pain management specialist for assistance?
The primary care physician would contact a pain specialist for a referral when the primary care physician feel that the patient pain is not controlled with the conventional methods he or she have tried. Also, when they feel that the management will need expertise from somebody that well trained in doing interventions or implantables, pain specialist can through their experience deal with the aspects of pain in a different way, also in a multidisciplinary fashion that will help the patients. So it is not only the medication management, it is a lot of other aspects like rehab, physical therapy, acupuncture, interventions. All of these can control the pain symptoms much better. So pain becomes part of the referrals of that neuroscience because pain is one of the important aspects of their disease process. Patient also that's been on medications for a long time that can have certain risks of organ toxicity. Those are patients that would benefit from pain management because you will use different approaches, diversify treatment, offer other options that would help these patients and possibly prevent complications from long-term use of certain drugs that can be risky to them. Continuation of care is very important. So when we see somebody in the hospital and we control their symptoms and get them on a stable regimen, before they're discharged, they get discharged with a discharge prescription from the hospital on that regimen, and then they do get an appointment in our office, or we ask them to make an appointment with their pain specialist if they have a pain specialist outside, or their primary care if they cannot continue with us for any reason, to make sure that the regimen that we adopted or the regimen that we started that controlled their symptoms continued, and if they need intervention, then they get the intervention as an outpatient. So their symptoms continue to be under control.